Well, let's jump in and get going here, folks. I'm Laura Koliskowski. I'm with I Conquer MS, and I also have multiple sclerosis. And I'm very pleased to welcome you to our final Chat with Chat for the 2022 year. We're happy you're here. And if you would, please just remember to keep yourself on mute unless you're asking a question. This presentation is being recorded, so we'd like to keep the background noise to a minimum if possible. And remember too, you have an opportunity to enter your questions during the presentation by selecting the chat button and typing in your questions there as well. Like I said, you're here with I Conquer MS, which is a part of the Accelerated Cure Project for multiple sclerosis. And we're what we like to say, we're where people with multiple sclerosis power the research is going to make a difference for us in our day-to-day living. I want to just take a brief moment and remind you, I mentioned that this is our last Chat with Chat for the season. These episodes are available to view on our YouTube channel, and that's youtube.com/@IConquerMS. Those links have also been sent to you, I believe, in multiple emails from I Conquer MS and from Holly Schmidt. So be sure if you missed any of these episodes, go back and catch them. As you can see, we've got a variety of topics and researchers who've worked with us and I Conquer MS to do research that's going to be meaningful. And speaking of research, I just want to take a moment to remind everyone to hop on board with us with Real MS. It's research engagement about life with MS. Our current survey period is open. We do this twice a year. It takes you anywhere from 30 to 45 minutes total to complete your data and help us, but you can pause at any time and return to it when you're ready to do more, so you don't have to do it in one sitting, although that's ideal, so you remember to do all the surveys. And this is where we're getting a lot of our research information, and also where we find participants to help us with other studies that we're doing in our ad hoc councils and helping us understand study design and study execution. So again, you would access Real MS through the I Conquer MS portal. If you've not signed up, it's never too late to join us. And for some of us, we're into like year 6 or 7 of collecting our data. So please join us for Real MS. I want to, at this point, like I said, I didn't want to tie us up because we got so much to talk about. Lots of great questions came in. So at this point, I want to turn this over to our host, Chat, who will introduce today's speaker. Chat.
Yeah. Good afternoon, everyone. I hope everyone can hear me okay. And just to let those of you who has been here for the first time, this webinar we call Chat with Chat for a reason. My name is Surachat, but I go by Chat. I'm a faculty and researcher at the Harrison College of Pharmacy at Auburn University in Alabama. So I'm going to be the host of our webinar today. Basically, that is it. So just also to like to let you know as well, you know, we name it Chat with Chat, but it doesn't really mean that you need to chat. If you're not comfortable to chat, if you like to listen only, you are more than welcome to do so. Okay, but if we would really appreciate if you like to discuss, you know, or ask questions at the end of the presentation as well. So then, you know, it's going to be more interactive. So as Laura mentioned, today we actually going to talk about the title of the webinar today is insurance coverage for people with MS and where are the gaps. Okay, so we are delighted to have our guest speaker today, Dr. Deborah Miller. She's a professor of the neurology at the Cleveland Clinic Lerner College of Medicine, and also she's a member of the professional staff at the Mellon Center for Multiple Sclerosis Treatment and Research of Cleveland Clinic. And she has been a member of the Mellon Center's interdisciplinary care team since the center's opening, in fact. So she earned her PhD at the Case Western Reserve University School of Applied Social Sciences, and is a master prepared social worker. So her research interests are quite obvious that she focused on the health services research and the use of the interpretation of patient-reported measures in assessing the outcome of care. And she is a collaborator and also on the several protocols to facilitate the inclusion of patients and the other constituents as full partners in research process. As a principal investigator, Dr. Miller completed an NIH-funded study titled Using the Internet to Improve Self-Management of Chronic Illness. She also was a member of the AAN panel to develop a clinical practice guideline for depression in MS or multiple sclerosis. So last but not least, again, she's a clinical social worker, and in her practice, interest focus on the marital and family adjustment to the consequences of MS and how this individual can effectively access community resources available to them. So that is about, what we're going to talk about today as well. So Dr. Miller, so the stage is yours.
Thank you very much. Let me get my screen started. Are you able to see my screen now?
Yes,
Okay.
but in a different view though, you can, I don't know if only me or not, but we can see your next slide as well. So, which is okay with me, but not the full screen with the slide.
If you click on the icon that shows a projector screen that's underneath your first screen, next to the magnifying glass, that should put you in the next view. Next to the magnifying glass at the bottom there, there's a thing that looks like a screen to the right of that one right there. Yep. Nope, that one, I believe. Oh, nope. Sorry. That one maybe.
Nope.
We had this set up.
Yeah. So how can I help here?
I'm not sure.
Can you go back to your PowerPoint screen maybe, and click on the presentation, again. You choose the PowerPoint screen.
I apologize for this.
It's okay.
It happens to the best of us, Dr. Miller.
Yeah. There you go. Thank you so much. Yeah.
Great. I'm sorry that it took some time to figure that out. I'd like to thank you for inviting me to talk about this research, which I had the pleasure of collaborating with members of iConquer-MS, Holly Schmidt in particular, on this research. And we were very lucky to have participants from the Accelerated Care Network participate in this research. So your organization has been really valuable in helping, gather this information. As is typical, I'm pleased to include my disclosures. I've contributed to intellectual property that's part of the multiple sclerosis performance test, for which I have the potential but have never received royalties. I also receive consulting fees from Roche and compensation for serving on the iConquer MS Care Partner Advisory Board. I'd like to offer some context about the financial importance of the kinds of insurances that we're going to be discussing today. And this is about people in the general US population. First, 3 out of 10 Americans indicate that they would not be able to pay an unexpected $400 bill without having to carry a balance on their credit card or borrow money from family, friends, or the bank. 1 in 4 of today's 20-year-olds can expect to be out of work for at least a year because of a disabling condition before they reach retirement age. Only 40% of US households have liquid assets to cover at least 3 months of their recurring expenses, and only 28% could cover these expenses for at least 6 months. A 2019 study of consumer bankruptcy filings found that 78% of debtors cited income loss as a contributor to their bankruptcy. This included 44% of those 78 people specifically citing medically related loss of work as a contributor. Finally, from 2019 to 2018, only 32% of Social Security disability insurance claimants had their applications approved, 20% at the initial application stage, and the remainder after a reconsideration or appeals process. I offer this information just to make people aware about how much on the thin edge of severe financial consequences for unexpected expenses or because of illness that most people in America live. And the chances for having or reaching these difficulties are much greater for individuals who are living with multiple sclerosis. The 5 types of insurances that I'll be discussing today all have relevance for people living with multiple sclerosis. The first is most obviously healthcare insurance. The second is short-term disability income for people who are temporarily unable to work because of an acute illness, such as an exacerbation of multiple sclerosis. The third kind of insurance is long-term disability income insurance. And when we talk about this type of insurance, we'll be talking both about Social Security disability as well as private disability income. The fourth is long-term care insurance, which is insurance not included in health insurance that pays for the personal care needs of people living with long-term illnesses. And the fifth is life insurance, and we'll also discuss why that's included in this discussion in a bit. Health insurance pays for some or all out-of-pocket and inpatient healthcare costs. Private policies have out-of-pocket expenses that include coverage premiums, deductibles, copays, and are expensive. These private policies can either be through an employer, private pay, perhaps through the Affordable Care Act's healthcare marketplace. And the types of costs that are covered by these different policies really vary greatly from insurance to insurance. Many people experience this variation when at the end of the year, their employers change health insurance companies, and what was covered previously will not be covered in the coming year, completely unexpectedly. The public policies that offer health insurance include Medicare, both traditional Medicare and Medicare Advantage, There were some questions that were submitted about the difference between these two insurances, and I'll discuss those in a bit. The other public policies are Medicaid for people who have or who are considered financially indigent and who live slightly above the US poverty level. TRICARE is an insurance coverage, or is an insurance plan for people associated with the military. Short-term disability is an income replacement benefit that provides a reduced percentage of pre-disability earnings on a weekly basis when employees are out of work. The policies provide benefits typically for 3 to 6 months, and the benefit ends after that period of time. The private policies are typically through an employer, privately purchased, and vary greatly in cost across policies. Public policies, which you would expect were available for working people, actually don't exist. The only public policy that provides short-term income insurance is through supplemental security income. And those benefits are based on federal poverty levels. And eligibility for SSI, supplemental security income is known, vary by state to state. So it would be difficult for me to comment on what the benefits are or what the eligibility criteria are in any given state. And I'd also just like to point out, before moving on to the next type of insurance, that Social Security disability, the primary long-term disability insurance that people depend on, does not become available until a person has been disabled for 5 months. So if a person becomes disabled, leaves work, and applies for Social Security disability, there is a mandatory 5-month wait between the time that they apply for the benefit, or from the time that they become disabled until they're eligible to receive this benefit. Long-term disability income insurance is a long-term income replacement benefit that provides a percentage of pre-disability earnings on a weekly basis when individuals are unable to work for an extended period of time. Private policies really vary greatly. Policy owners who have long-term private policies should review their coverage regarding percent of previous earnings paid and duration of coverage. For policies, the definition of disability varies from the ability to perform a person's usual work to not being able to perform any work at all. The public policies include Social Security disability and SSI supplemental security. As I mentioned previously, Social Security disability requires a 5-month wait before a person becomes eligible. The benefit or income that's received on a monthly basis is 40% of recent earnings. And it's important to note that Medicare, which is the insurance associated with Social Security disability, begins only 24 months after becoming eligible for SSDI. So that not only is there a 5-month period when a person would be without earnings, there's an additional 24 months before a person would become eligible for the federal insurance that is associated with SSDI. I don't mean to paint too bleak a picture about this, because many people, when they're applying for disability, have family members who are still working and bringing in income, and who possibly have insurance that the person with MS can join on to. But nonetheless, it's a really abrupt loss of income and change in what is the likely insurance benefit. Supplemental security income, as I said on the last slide, is based on the federal poverty level, and the benefits vary by state to state. Long-term care insurance is designed to offer financial support for long-term care services, including medical and non-medical care that include help with health and personal care needs, also known as activities of daily living. And those include bathing, dressing, grooming, either at home or in congregate care facilities. This is the least commonly held type of personal care insurance. And typically, this insurance, if it's available, is obtained through policies offered by employers. And when an employer offers this type of policy, it's usually to people who are in relatively high income brackets, not typically offered to people who are engaged in manufacturing or other similar industries. Medicare does not cover the majority of these services. Many people anticipate that having Medicare will make them eligible for help with activities like personal care, gaining the type of additional resources that would help them manage on a day-to-day basis. And Medicaid, which again is associated with SSI, does cover these services, but only for people who meet the significant financial need that we described previously. Most people don't think of life insurance as a policy that could help cover expenses related to having multiple sclerosis or living with multiple sclerosis. But it's an insurance that is traditionally intended to pay, and it is traditionally intended to pay a benefit to survivors after the insured's death. But it's important to know that some policies can be cashed in while the owner is still living and to assist with paying for long-term care services. There are several different types of policies, including those known as term life or whole life. And it's important for individuals to understand the specifics of the policy that they hold or are planning on purchasing. The National Multiple Sclerosis Society reports that many people with MS have this type of insurance, but it is unclear if the policy was obtained before or after the MS diagnosis. With that background, I'd like to next move on to the findings of a recently published manuscript research that I mentioned previously. The title of that research was Assessing Access to 5 Types of Insurance by People with Multiple Sclerosis using a Cross-Sectional Online Survey. And if you're interested in looking for this, this manuscript, it's published in the Journal of the International Journal of MS Care in 2021. The authors include myself, Stacy Caulfield from NARCOMS, which I'll describe later, Sarah Planchin-Pope, members of the University, Case Western Reserve University, as well as Holly Schmidt, and Sabrina Corletto, who is an insurance expert at the University of Georgetown. And again, I apologize, the exact connection for obtaining this is in blue and pretty dark to see, but I'll be happy to share my slides so that they can be distributed to you, and it'll be much more obvious. So background about this research. Working age adults in the US most often access the types of insurances that we discussed through employer-based education and insurance plans. If unable to work, disabled individuals lose the income and care protection that these insurances provide. It is a particular concern for people living with chronic progressive diseases, including MS. A 2016 US study demonstrated that with people with MS, even with a low level of disability, using the expanded disability status scale, may be limited or unable to be gainfully employed. And this is for people who are in the range of 1.5 to 3 on either the expanded disability status scale or the patient-determined disease steps, which is a self-assessed level of disability that's associated with the expanded disability status scale. Just to point out the consequences of inability to work, which is something that most people living with MS have to consider, at least for a brief period of time at some point in their work career. In 2011, Noyes estimated that the annual indirect costs for having MS among US residents averaged $19,700 per individual from missed work, underemployment, and episodes of unemployment due to disability. That $19,700 is $26,500 in today's dollars. And that does not include the cost of healthcare costs, including disease-modifying therapies. Now, I'm offering this information not because I'm indicating that most people living with MS are even aware of these possible concerns. There's just not a general awareness among the general public about the importance of these insurances, or the fact that many people in the general US population will become dependent upon them at some point in their working life. I'd like to just drill in on some of the consequences of not having short-term disability insurance. People without this disability insurance who develop an eligible long-term disability can earn no more than $1,260 a month for 5 months before becoming eligible for SSDI. This relates only to the applicant's income. As I said before, if there are other members of the household who are working, their income does not count to that monthly limit. When approved for SSDI in 2023, the average monthly payment for just the disabled individuals will be $1,483 per month. Eligible dependents may receive their own benefits. That would be dependent children for the most part, or a disabled spouse. And that amount is typically 50% of the disabled worker's benefits. And as I mentioned before, Medicare insurance does not become available until 24 months after the SSDI approval. And it's important to understand that this insurance does not extend to other family members. I apologize if I sound like I'm repeating myself, but some of these points are kind of hard to grasp. And to see how everything is intertwined is the reason why I'm repeating some of this stuff or reconnecting it back and forth. There have been recent changes in the economic landscape that affect insurance access. The passage of the Affordable Care Act in 2010 ensures access to insurance care regardless of pre-existing illness. It's important to be aware, again, that the insurance is available through the Affordable Care Act and the marketplace, do not provide access to long-term care, and do not provide access to other kinds of insurance that we're discussing. The Affordable Care Act only provides access to health care. Since the economic downturn of 2008, increasing numbers of workers are employed as consultants or contractors and don't have access to these employer-provided benefits. The data for this survey that we'll be discussing was acquired before the COVID pandemic. So it's likely that the people who are working in circumstances that allow for employee-based insurance is lower than what we found when this research took place. The study goals of this research were to determine the health and personal insurance status of community residing working-aged individuals with MS, to identify characteristics of those who are at risk for not having such insurance, and to determine whether those with insurance obtain coverage before or after their MS diagnosis. In terms of the methods that we used to develop this research, we used a multi-stage process to develop an online survey. First conducted focus groups in Washington State, Texas, and Ohio, as well as North Carolina. Three major areas of concern emerged during these focus groups. Concern about securing coverage, uncertainty about the coverage and costs of coverage, and the consequences of maintaining coverage. That is, deciding to pay premiums as opposed to meeting other household expenses, including potentially home repairs, sponsoring children's college education. And then based on the information that we got from the focus groups and the questions that we generated based on those focus groups, an expert panel reviewed the proposed survey. And those who reviewed the survey included representatives of the National Multiple Sclerosis Society and the Accelerated Cure Project. The online survey was programmed and administered by the North American Research Committee NARCOM staff. And the validation of the study in terms of readability and understandability was conducted by the Mellon Center research staff. The inclusion criteria for the respondents to participate in this survey were US residents and citizens regardless of work status, ages 18 to 64. Now I have to say that there were many people who became aware of the survey who questioned why we limited the age to 64 or younger, but we were trying to focus on people who were of working age to get their current experience rather than having people who were depending upon recall from their experience when they were in the workforce. Respondents were registered with one of three groups, either NARCOM's, iConquer MS, or the NMSS Minority Advisory Council. Excuse me, let me go back. The reason why we included the NMSS Minority Advisory Council is that we're aware that both NARCOM's and iConquer MS do not necessarily reflect the general race distribution of MS in the US, and we wanted to oversample people who participated in the Minority Council to make sure that we got that perspective. Recruitment occurred through the organizer's typical recruitment methods. The respondents were limited to answering only one survey. So if an individual belonged to both iConquer and MS and NARCOM's, they could only answer the question once. The survey was available between August and November of 2017. So again, well before the pandemic. This is a very busy slide, and I apologize for that. But just to give you an idea of who participated in this, we had a total cohort respondent set of 2,507 people. 96% had health insurance. Only 18% of that 2,500 had short-term disability. 27% had private long-term disability. a very small minority, 9.7%, reported having long-term care. As far as life insurance is concerned, 58%, 59% had life insurance. So clearly the most common types of insurance were health insurance and life insurance. I wanted to point out that there were differences in the access to insurance based on MS disease status, and that it became more difficult to maintain insurance as people emerged into progressive disability. Ethnicity. I wanted to point out that we looked at the percentages of African American, Caucasian, and Hispanic, and the relative rates of access to each of these types of insurance is consistent across races and ethnicity. The cohort characteristics overall, the surveys were started by 3,000 people, and 2,500 met the inclusion criteria and provided complete demographics and were included in the analysis. These respondents were predominantly female, 89%, white, 91.2%, Hispanic Latino at 3.8%, and primarily married. A majority were either employed full-time, 32%, or not employed due to disability, 46%. Respondents' age was 53 years old. Most respondents reported relapsing remitting a course of MS and a disease duration of 16 or more years. Most were receiving their care from private neurologists, and the respondents described as being in good health, and only a minority were current spenders. I would be interested when we come to the discussion component of this presentation to see how closely this group represents those who are currently on the call and how relevant this information seems to you. I'm going backwards. The source of insurance and when it was obtained. This is very interesting. For health insurance, 68% of respondents obtained their policy through public sources and 75% through private resources, with some individuals having both public and private. A majority of the respondents, 65%, obtained their health insurance policy that was providing them coverage at the time of the survey after their MS diagnosis. Of those with private coverage, the majority, 82%, had coverage based on being employed, while 7.9% obtained their policy through the health exchange, and 8.3% obtained a policy private outside of the exchange. For those 18% of the survey respondents who did have short-term disability insurance, the majority, 95%, obtained it through an employer, and more than half of the respondents with this insurance, 52%, reported obtaining their current policy after their MS diagnosis. Regardless of employment status, being married was also associated with increased odds of having a short-term disability policy. A majority of respondents, 75%, reported that they met the work requirements for Social Security disability, and of that number, 50% were receiving benefits. A majority of those with long-term disability income through insurance obtained their policy through their employer. Of the people who had long-term disability insurance, 390, or 58%, reported obtaining their current policy after their MS diagnosis. The majority of those few respondents who reported having long-term care insurance, different from long-term disability income insurance. The majority of those few respondents who reported having long-term care insurance either purchased it or obtained it through an employer. Again, this number of individuals with this insurance is small, but a majority of them reported obtaining their current coverage after their MS diagnosis. Having life insurance was associated with having a spouse, being employed, even though the majority of respondents purchased their policy privately. A current policy for life insurance was the least likely insurance to be purchased after the MS diagnosis, perhaps because of competing financial responsibilities or the underappreciated long-term consequences to the family of not having this kind of insurance. I would like to point out that although there was a very high majority of people who responded to obtaining these policies after their MS diagnosis, and respondent recalls are usually very high, we had no way to actually validate or go back and ask people to confirm the way that they rather spontaneously responded to these questions at the time that they completed the insurance. So while it's encouraging to see that these people, that many of the respondents were able to obtain the various kinds of insurances after their MS diagnosis, I think that that finding has to be sort of reviewed with caution until we have a way to confirm this in a more detailed way. Sources and timing of current policy. Again, it looks as if people are getting their policies after their diagnosis. This is not necessarily what we hear when talking to individuals, just sort of off the record. But I think that this report really is encouraging and requires further investigation. And I'd also like to point out that there were a total of 400 people, 16% of our sample, who were unsure if they were eligible for Social Security disability. And this is really disturbing because it's the primary source of insurance for individuals of working age who have multiple sclerosis, and not being sure about what it, I think that the questions that people had about their eligibility was in terms of the work requirements, how long a person has to have worked, and what the disability criteria is to become eligible. But this is a real point that speaks to the need for education about eligibility for this public insurance. I'd like to offer some conclusions about this research. This large registry-based survey identifies a variety of demographic and disease-related factors associated with access to different insurance policies. Respondents who did not have current coverage for short-term disability and long-term disability insurance were more likely to have progressive disease and not full-time employment. This really isn't surprising given the immediate circumstances that these folks with progressive disease are managing early in their disease. This survey's results were very similar to a survey conducted in 2000 by Izzioni and Nagel, indicating that these trends have remained constant over nearly 15 years. This suggests that there has been limited intervention or advocacy around acquiring or maintaining these essential forms of financial protection. Again, I want to emphasize that this is not the fault of individuals who have MS. And to sort of emphasize that point, I came across this yesterday as I was preparing the final conclusions on this talk. This is a Washington Post report from 2 days ago that describes Social Security offices as being critically disabled to determine benefits for individuals across the United States. Texas has the worst average and has a processing time for initial claims that have more than doubled from 79 days in 2019 to 214 days in fiscal year 2022. And the states that have the darkest blue are facing that same sort of backlog in processing disability determination claims. And it's very few states that are not affected by this dysfunction within the Social Security disability processing offices. Just my discussion about this is that these findings should not be interpreted as being the responsibility of individuals living with MS. In the US, most households are not able to manage an unexpected expense of $400 a month, much less take on the added cost of insurance policies. Managing the complexities of life with MS while maintaining valued roles and responsibilities can be consuming. The majority of these insurances are available through private industries who have a clear eye to their profit margin. So they're not going to lose money on offering policies to people who cost them money in the long term. The federal and state agencies that manage all manner of government programs are understaffed and overwhelmed. There are some mitigating strategies that I'd like to offer. I suggest that we strongly encourage advocacy and education strategies by MS Wellness and advocacy programs. And many of these organizations are already working to eliminate the 5-month delay in receiving Social Security disability and are helping to encourage financial and long-term care planning. That's the end of my presentation. I have prepared some responses to questions that I received previously. And I would ask Chat or Laura whether you would like me to proceed to answering those questions or how you'd like to proceed from here.
Yep. Well, first of all, we definitely can do that, Dr. Miller. But first of all, thank you so much for your presentation. It's really informative. I learned quite a bit, in fact, about the Social Security Disability Program. So what we like to do is indeed, we like to give the opportunity to, we have about, in fact, more than 10 minutes now. We like to give the opportunities to, participants who attend this webinar live to ask if you have any questions first. So anyone have any questions? You can unmute yourself and also, speak it out, and then we'll go from there.
And Chad, I see a question in here from Janine Colombo, who wants to know, is life insurance necessary or advised for a single unmarried individual with no children? Is there benefits to having it or consequences to not having it?
Can you comment on that? Yep.
Yes, for a single person with no children, there really is limited advantage to paying those premiums. The one thing that I would suggest is that the person has adequate savings or a policy for burial. But other than that, unless there's somebody that they really want to leave an inheritance for, but they could also check to see whether they can cash in that policy to pay for long-term care if they already have the policy.
All right. Any other questions?
Did I completely overwhelm you with information here?
Not not to me, but any other questions? Otherwise, I can bring some. In fact, why don't I try? So this is actually have been on my mind because when I work with the a group of patients, and one of them actually raised an issue, and I could not really tell her or him. I can't remember quite. They were one of the reasons that they did not apply for the the disability from the Social Security or Medicaid or disability program, just because that she was afraid that after she passed, if she actually apply to get the benefits, and then after she passed, then the government going to come after whatever his or her estates that left over. Is that true, Dr. Miller? Can you comment on that?
Well, there are two answers that I'd like to give. The first is for people who are receiving Medicare disability. The government is very generous in allowing them to attempt to return to work. There's a trial work period that lasts for 36 months that they can be earning their wages as well as their Social Security disability benefit. But if somebody is really working towards that and is close to the 36-month of working and receiving Social Security disability, it would be really important for them to consult with either somebody from a lawyer or some other person with expertise in this area about what the consequences are of losing the income benefit and the Medicare. So that's one part of the question. In the question, I think that the person was asking you, Chat, was about Medicaid, which varies from state to state. And most states do require recipients of SSI, Supplemental Security Income, to sign a document that allows estate recovery once a person is deceased. There are lots of caveats or exemptions to the state claiming that money, especially if there's a living spouse or if there's a dependent who's living in the household where the Medicaid recipient resided. So there are exemptions to that. And this is completely off the record. I mean, this is completely not official, but I have never known a state Medicaid organization that had the wherewithal to figure out who all was covered or how to go about reclaiming their estate. So I have to say that people have to sign that document. I've never known it to be enacted, but this is one person's experience. So I just don't want to overstate that everybody can sign that document and not be concerned.
Yep. Thank you so much. And believe me, Dr. Miller, that has been on my mind for at least 4 or 5 years. So, and I could not really figure that until I talked to you today. I kind of like to acknowledge, in fact, we have a good question from our participant today. But I feel like her she would be kind of better talk with the National Multiple Sclerosis Navigator, because her case is quite specific and also complex. So, and if she doesn't mind, but if otherwise it's in the chat function. So just like to again ask everyone, anyone have any question for Dr. Miller?
Could I put in one more plug? I'm recognizing how expensive MS is and how limited most people have for resources, but I can't overestimate the value of talking to either a financial planner or an estate attorney about asset protection. There are many ways to preserve a family's resources and prepare for the possibility of long-term care. And that should happen very early on, as early as possible, that we can help educate people about this need.
Yep. Laura, I see you raised your hand.
I did. I have a question, Dr. Miller, can you just speak in general terms of what happens to people when they're on Medicaid and then become the age for Medicare, and that difference in how medical benefits are processed or treated? I asked specifically because I had a good friend who had MS for a good 25, 30 years, and she called me the day she turned 65, laughing hysterically because she had been told she no longer was disabled. She was just old and retired, but her benefits changed quite a bit. So what was available to her under Medicaid was not as easily accessible under Medicare. Have you seen any of that?
In my experience in my state, a person who's receiving Medicaid has an income that is low enough that they would continue to be qualified after they turned 65. So they would most likely, their Medicare would be secondary and their Medicaid would continue to be primary. So they would not lose eligibility for Medicaid, but they would add the Medicare coverage onto it. That's called dual eligible. And some states do have different benefits when a person is dual eligible. But a person should not lose Medicaid just because they become Medicare eligible. Does that make sense?
Yep. Yeah, I was just wondering, and this is but state by state, dependent on how Medicare and Medicaid is, or how Medicaid is structured within a state.
Yes,
Okay.
and dual eligibility.
Yeah. Thank you.
Sure.
We still have a couple more minutes before I wrap up again. Anyone here want to ask Dr. Miller your questions?
Even though I realize that my question is long and complex, can I just verify about the 6 months before being eligible for Medicare?
Please do, Hillary. Yep, please.
Yeah. So I've had a very, very hard time. I turned 65 in September. It took me a long time to find out that as long as I'm still working, I don't need to worry about Medicare. But in the process, I've learned that when I do apply for Medicare, I can't have had a high deductible spending account medical care for 6 months before going on to Medicare. Medicare, I will be penalized by the IRS for doing so. But I can't get anyone to answer the question as to if I want to retire January 24, that's not now, that's next year. But I have to select my health insurance now for 23. And if I select a program with the high deductible, it means I can't retire until July of 24. Is that seeming to make sense to you?
I would be talking way beyond my scope of practice to try to respond to that. I do know that there are restrictions on the premiums for Medicare, whether a person, and it's different, like there's a difference between health spending accounts and financial savings accounts. And I know that there are, my answer is that I really apologize, but I can't help you with that.
No, it's okay. Medicare can't help me with that. My federal agency can't help me with that. No one seems to be able to help me with that. And so what I'm planning on doing, because I want to hang on to my high deductible insurance, is I'm going to go ahead and sign up for it again, so I will be covered in 2023, and then just work part-time and because I have enough leave to do so, and then pick up Medicare and retire in July. But God, you just can't get straight answers on this kind of stuff. It's just,
The only thing that I could suggest is that you attempt to apply now without any expectation of going through with the process. But if you talk to an agent now, as if you were going to apply,
yeah.
you may get at least one answer.
Okay. Well, thank you for trying to help me. I appreciate that.
Absolutely.
For someone with MS who has cognitive issues, this has just been a nightmare.
I so appreciate that fact. And I really hope that all of the agencies that are involved in helping people with MS sort of take this whole issue on as a really important advocacy and research issue.
Yeah. I'm glad I started a year in advance.
Yes.
Yep, a good idea, Hillary. Yep. Well, Hillary, thank you so much for your question. And and I kind of like to wrap up right now. And without, with no doubt, Dr. Miller, this issue is very, very important and also very, very interesting. We probably need to, more time, like, in one more hour to discuss and also answer, all the questions here. But unfortunately, our time is up. So I like to take this opportunity to thank all the participants for being here with us live today. And I also like to thank iConquer MS to kind of, create or allow us to have this platform to communicate between the researcher, who is the Dr. Miller today, with our community. And just to let everyone know, please stay tuned for our Chat with Chat program for next year, 2023. So we are still working on our next year program, and we'll let you know when we have the program settled down. So and last but not least, I like to wish everyone happy holidays. Thank you so much.
Take care.
Yep, bye.